Hello, 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 hello. Good morning. Good morning. Sorry I started late. I need to clear my table this morning before going live. That is why I gave you guys heads up that I'll be going live. So, how are you guys doing? Today is another day to discuss about issues of diabetics. All right. So, how are you guys doing? Good afternoon, wherever you are watching me from. Good evening, depending on the time zone where you are watching me from, and good morning, depending on your time zone. How is your Saturday going? All right, you're welcome to today's program. I'm going to go straight to the program. Let's uh, go straight to the program, okay? I'm not going to waste much time today to dive into today's program. So I'm going to be discussing, I've talked about this issue before, about neuropathy. Okay, we've discussed about neuropathy. Another term for it is diabetic feet or diabetic foot, depending on which way you can use it. Diabetic neuropathy is a medical term for diabetic feet. Diabetic feet is a layman's language to understand what the doctor is talking about. So when they say diabetic neuropathy, you might get lost. What does he mean by diabetic neuropathy? So that is why if you watch me, I tend not to use medical words in expressing my views regarding diabetic issue or high blood pressure or cholesterol. I tend to bring it down to the lowest level that even a common woman or a man in the street will understand what I'm talking about. So diabetic neuropathy is same as diabetic feet or diabetic foot. Okay, so that's the layman's term for it. Okay, so we're going to be discussing. I'm going to be telling you guys everything you should know about diabetic neuropathy or diabetic feet. All right, so that is what I'm going to be discussing today. I have 1 hour to discuss this topic today. Okay, I'm going to be discussing the symptoms. All right, we're going to be discussing the symptoms of diabetic neuropathy. I'll be discussing the types of diabetic neuropathy. I'll be discussing the causes of diabetic neuropathy, the diagnosis of diabetic neuropathy, treatment, and prevention. So I'll start from that is how I'm going to discuss about it. So the topic today is things you should know about diabetic neuropathy. If you're a diabetic patient or you're a caregiver, you are looking after somebody in your family that is diabetic, it is important you listen carefully about this topic. Diabetic neuropathy, it's the same thing as diabetic feet or diabetic foot. What you hear is somebody have a diabetic foot or diabetic feet is the same thing as diabetic neuropathy. Diabetic neuropathy is a medical term for it. So once again, I'm going to be discussing about the symptoms, types of diabetic neuropathy or types of diabetic feet, the causes of diabetic neuropathy, the diagnosis of diabetic neuropathy, the treatment and the prevention of diabetic neuropathy is what I'm going to be discussing today. So it is very, very important you listen carefully because if you're a diabetic or you're a caregiver, this is for you. You should know one or two things about diabetic neuropathy. If you're a caregiver or you're a patient, you must pay attention to your feet all the time. Your feet, you must pay attention to your feet. Every morning, every day, every afternoon, every evening, check your feet all around to make sure there are no blisters, there are no wounds, there are no cracks. Okay? Because early detection of diabetic feet is the beginning of saving that leg to avoid amputation or to avoid foot ulcer. Because diabetic feet or diabetic neuropathy is going to lead you to foot ulcer. From foot ulcer, if you don't catch it in time, it's going to lead you to amputation. You'll cut one of your feet or cut one of your toes. So that is why you see some people they lose their limb or they lose their feet or they lose both feet because of diabetic neuropathy. So that is why you have to know the symptoms, the types, the causes, the diagnosis, treatment, and prevention so that you don't lose your feet. Okay. So once we are diabetics, at all times, you are a caregiver at all times, you must pay attention to your feet. If you notice any wound, any ulcer, or any kind of crack, changes in your feet, you are losing sensation or temperature, go and see your doctor immediately for them to check it out. The earlier, the better. So that is what I'm going to discuss. It's very, very important you understand what diabetic neuropathy is all about. If you're a diabetic or you're a caregiver taking care of somebody that is diabetic, you must at all times, every day, check your feet. You go raise the feet up, check everything all around to make sure there are no blisters, there are no wounds, there are no cuts. Check the toes, the toes to make sure there are no ingrowns. You must make sure you cut your nails, the toes of your nails all the time. Keep it clean and tidy. All right. If you are a diabetic or you are a caregiver, you must at all times avoid wounds, cut, blisters, anything that is going to make it for you to expose your white blood cells, to expose your skin, to have wound. Avoid it. You must avoid falls. So as a diabetic, you must check your feet every day, every afternoon, every evening to make sure your feet are in good order, to make sure you are feeling your feet. So this is what I'm going to be discussing today. Anytime you lose any sensation in your feet, you're not feeling your feet, you're not feeling temperature, there's a problem. So let's go into detail. So what is diabetic neuropathy? Okay, it's all about nerve damage. I've said it before, it's all about nerve damage. I'm going to put it here. All right, the definition of diabetic neuropathy. You see why sometimes, let me put it, because somebody have asked me, why do I put, like, see what I posted on the screen? There's a reason why I paste it. Because I have some fans that are deaf. I have some fans that are deaf. In fact, they are the one that send me an email that they enjoy my program, but they are deaf. So if there's any way I can post it on the screen so that they'll be able to read it and understand, because when I speak, they cannot hear. So somebody have to interpret to them. So that is why you see when I'm talking, I know you can on the title or whatever caption, it's printed all the captions out. But I also need to paste it for those that are deaf, so they'll be able to read and understand what I'm talking about. So that is why you see when I'm talking, when I'm defining a topic or when I'm trying to express a point, I paste it on the screen so that those that are deaf can read it and understand what I'm talking about. So that is why you see I'm going to combine everything. So it's all about accommodating everybody. Those that are deaf can read and understand what I'm talking about, and those that are not deaf cannot understand when I speak. So that is why you see I have to explain this, because I have number of fans that are deaf. In fact, they write me, and that is why I have to get this involved. So let's define what is diabetic neuropathy. As you can see on my screen, it's a type of nerve damage that develops gradually and is caused by long-time high blood sugar levels. While there is no cure, managing blood sugar levels can slow its progression. Okay, it's all about your nerve damages. And this is part of the complication. If you are not taking care of your blood sugar level, if you are not bringing it out to the normal level, it's going to result to this diabetic neuropathy, the nerve damage. And you, as a diabetic, you must avoid anything that is going to cause you to have a nerve damage. Nerve damage to your organs can cause a lot of damages: blindness, diabetic feet, okay, sudden death, sexual impotency, or lose of libido. All those things is what I'm going to discuss today. Your digestive system is also going to affect your digestive system. That's why sometimes you see that you have constipations. So diabetic neuropathy is a type of nerve damage that develops gradually and it is caused by long-term high blood sugar levels. While there is no cure, managing blood sugar level can slow its progression. That is what is called uh, diabetic neuropathy. Okay. Um, Lucy from South Africa, you're welcome. Lucy, I acknowledge your presence. You are welcome. Okay. So diabetic neuropathy is a serious and a common complication of type 1 and type 2 diabetics. I've said it before. It's a serious complication of type 1 and type 2 diabetes. It's a type of nerve damage caused by long time, as I said before, sugar level. Okay. If you are not controlling your sugar level at all times, okay, and you have too much elevation of sugar level constantly, instead of you bringing down your sugar level constant to the normal level, you allow your sugar level to rise constantly over a period of time. You start developing diabetic neuropathy gradually, slowly. sometimes over the course of several decades. It's something that starts from stage 1, stage 2, stage 3, stage 4. By the time you notice, it's too late. That is why you see some people that are diabetics, you see them with foot ulcer and they go for amputation because they've ignored those norms and regulation guiding diabetics. As I said before, diabetes is a kind of language, or it's a kind of culture that we all have to abide by, live by. It has rules and regulations. It has norms governing diabetes. If you stick to it within the limit of those norms and regulations, you are going to avoid these complications. But when you go above and beyond the rules and governing diabetics, you ignore it and then you start living above beyond those rules, then you are inviting those complications to come, and then that's going to cause you lose your limbs, amputations, and sudden death. So you must live within the rules governing diabetics. Those things that your doctor tells you not to do, abstain from them. Whatever they ask you not to eat, abstain from it. And whatever you are eating, know the quantity of whatever you're eating. It's all about add and minus. So whatever you're going to consume, you have to ask yourself, does this add more value to my health, or does it subtract or cause me more harm? So every minute of your life as a diabetes, you have to gauge which is more important for you, your life or the food in presence of you. So you have to watch what you eat, amount of what you eat, and when to stop, and when to soon say no. So, for instance, when you go for an occasion, a party, or wherever you are, and you are being forced to eat certain things, and you are telling them, no, no, I'm okay, and they keep coming back, telling you, eat, you stand your ground and say, no, I'm okay. Because you value your life, you know why you are abstaining from consuming such foods. They might not know why you are saying no, but you have to be disciplined and say, no, I'm okay, I'm fine. Okay, so you have to know the limit. You have to know when to say, no, I'm not going to consume this because I value my life. I have health issues that I have to live according to the norms governing diabetics. So when you are not taking care of your sugar level over a period of time, okay, or you go home and then you start eating those things doctor asks you not to eat, you start living the previous life you're eating over a period of time, gradually from stage 1, stage 2, stage, it doesn't occur overnight. It's a slow progression over a period of time that they're going to develop diabetic feet, which is called diabetic neuropathy. And that's what is going to cause you nerve damages. It's a silent killer. You might not even notice it in the stage 1. It's a gradual, slow progression. And by the time you get to that stage, for final stages, all your nerves are completely damaged. You won't be able to heal those ulcers. And the only way for you to survive is to have an amputation. Because that is the end stage. And if you cannot have an amputation, that's going to cost you your life. So it's all about complications that arise from, if you're not managing your type 1 or type 2 diabetes, if you're not controlling your sugar level, then you're inviting diabetic neuropathy. So if you have diabetes and notice numbness, tingling, pain, or weakness in your hands or feet, you should see your doctor immediately. Once you notice any symptoms within your feet and your hands, approach your doctor and discuss those symptoms, what you're feeling. Okay? Because in case if you have a prolonged peripheral neuropathy, you may be vulnerable to injuries or infection. So don't allow it to get to that a stage whereby if you have an infection, it's too late to be cured. It will be too late to be cured. Now, feel free to ask any question for those. For those. Now, there are different types of diabetic neuropathy that affect different areas of your body, causing a variety of symptoms. There are different types of diabetic neuropathy that are peculiar to certain areas of your body and causes different type of symptoms. And this is all what you have to understand today. So if you have diabetes, it's all about paying attention to your sugar level, pay attention to your health, to your body, be able to interpret any new symptoms you notice within yourself. It's all about being conscious of yourself. You have to be conscious of yourself at all times. So when you notice any symptoms, you have to be able to interpret it. Why am I having such symptoms? Now, you have to keep a date when you started noticing those symptoms and for how long. Because when you go to see your doctor, he's going to ask you, when do you start noticing those symptoms? For how long? That will guide your doctor to know what you're going through. Okay, so it's all about nerve damage. Ineffective controlling of the sugar level can cause you diabetic neuropathy. It has a slow progression. Okay, it has a silent symptoms. It doesn't develop overnight. It's something that grows from weeks, month, from days, weeks, months, and years. Slow progression. When it gets to the final stage, where it's going to be too late for you to be able to handle the situation, and that is why everything depends on you is managing your sugar level at all times. It is important you manage your sugar level at all times. Okay. So let's you guys know definition of diabetic neuropathy. It's a type of nerve damage that develops gradually and is caused by long-term high blood sugar levels. So while there are no cure, managing blood sugar level can slow your progression. Everything depends on managing your sugar level. To avoid developing this complication of diabetic neuropathy, it's all about managing your sugar level. You have to make sure your sugar level remains constant where it's supposed to be. And once you are managing your sugar level, then you are avoiding having diabetic neuropathy. Okay. So let's go to what are the symptoms of diabetic neuropathy. Okay. What are the symptoms of diabetic neuropathy? Okay. It is it's common of symptoms of that is sorry, I'm trying to short of word. It's common for symptoms of neuropathy to appear gradually. Remember in my previous video, I said diabetic symptoms, you might have diabetics for 6 months, a year, 2 years without even you noticing you are diabetic. Because the symptoms, most of the symptoms are silent. It's only two that you can notice immediately. So I've seen people that are diabetic for 6 months, a year, they don't even know that they're diabetics until they run a blood test. They've been, because some of the symptoms are silent. The same thing applies to diabetic neuropathy. So the common symptoms of neuropathy to appear gradually is something that appear gradually. And I've given you guys an example. When you have a headache, for instance, you have a headache in the morning, you take a painkiller, it goes away. Then in the afternoon, it comes back again, you take a painkiller, it goes away. If that headache consistently lasted for 5 days, it's no more a common headache. It's something you have to approach your doctor to find out why am I having constant headache for over 5 days? Because it is gradually. That headache might come in the morning and disappear, and wait till in the evening and appear again. You see the gradual process. In the morning, you have a headache, you take a painkiller, it disappears. It doesn't disturb you during the day, but as soon as you start going to bed, the headache appears again. And then you drink another painkiller, it goes away overnight. It does not appear in the morning. Later, it appears in the afternoon. Now you see the progression. So it gradually progressing from minor to mild, and then major. So if that headache lasted for more than 5 days, you have to stop self-medication and then approach your doctor to, investigate why are you having constant headache over a period of 5 days. So that might be a warning amber-like sign that there is something more than headache in your system. The earlier that you catch it, the better. Because from that headache, it might go to the another level, another stage. So that is why you have to pay attention that diabetic neuropathy, most of the common symptoms appear gradually. In many cases, the first type of nerve damage to occur involves nerves of the feet. You're diabetics, the first symptom you're going to be hearing, those that are diabetics, you see them experiencing nerve burning sensation in their feet, and numbness or tingling in their feet. That is where you start experiencing those nerve damages if you're diabetic. So, and the only way is to make sure you keep your sugar level at a normal level. Make sure your sugar level doesn't go above the normal level. It must remain constant where it's supposed to be. That is how you prevent it, the progression of diabetic neuropathy. And this can lead to symptoms, sometimes painful, pins, needles in your feet. These are all the gradual process that the symptoms tend to appear. So Now we are going to discuss the symptoms, because some of the symptoms vary depending on the areas affected. The symptoms of diabetic neuropathy varies depending the areas affected. When I say affected, it's depending the area that the nerves have either beginning or completely damaged. Okay, common signs and symptoms of different types of diabetic neuropathy include, all right, so these are the symptoms of diabetic neuropathy that I'm going to discuss with you. What are the number one diabetic neuropathy? Number one is sensitive to touch or loss. Number two is loss of sense of touch. Okay, I'm going to give you guys about 20 symptoms of diabetic neuropathy. So one and two. So one and two is sensitive to touch, loss of sense of touch. So if you're having diabetic neuropathy or diabetic feet, you are going to be sensitive to touch in your feet, around your feet, or loss of sense of touch. You cannot even feel your feet. You cannot even feel your hands in your finger. Completely your feet. You can't even feel anything. You can't even feel temperature changes. You can't even feel coldness. You can't even feel hotness. That means you have lost sense of touch. When you touch your feet, you can't even feel it. Okay? Or sensitive to touch. Sometimes you don't want anybody to touch your feet. Touching your feet sends some pains to your body. Okay? So let's go to number 3 and 4. Difficulty with poor coordination coordination when walking. Number 3, difficulty with coordination when walking. If you have diabetic neuropathy or diabetic feet, you find it very difficult to walk. Sometimes your walking is not coordinated. You know, when somebody is healthy, doesn't have any problem in their feet, you see they walk normal. Your walking is coordinated. You walk appropriately. But if you are having diabetic feet, your coordination when walking is not proper. Either your left feet is okay, your right feet is okay. So you're limping. You're limping or you're walking with a stick, or it takes you to go to lift your right feet to the next feet. It's going to take about 2 minutes. You walk, you stop, you take a breath, you lift again. So that is the difficulty with walking coordination. That's number 3. And number 4, numbness or pain in your feet. Numbness or pain in your feet, in your hands or feet. That's the number 4 symptoms. So let's go to number 5. Number 5 is burning sensation in your feet, especially at night. Okay? When they say especially at night, does not mean you don't have it during the day or during the morning. Okay? So burning sensation in your feet, especially at night, is number 5. And number 6 is muscle weakness or wasting. Muscle weakness or wasting. Let's go to number 7. Bloating or fullness. You know when you're bloating or you feel fullness. That's number 7. Number 8 is nausea, indigestion, or vomiting. And number 9 is diarrhea or constipation. Okay, we're going to talk more about constipation in the later stage of the symptoms, because it has to do with your nerve damage, digestive nerves. Okay, so number 9 is diarrhea or constipation. So let's go to 10. Dizziness when you stand up. Number 11 is excessive or decreased sweating. Number 11 is excessive or decreased sweating. And number 12 is bladder problems such as incomplete bladder emptying. Okay, because you also have, yes, there are nerves in your bladder. So when your nerves are weak or damaged, you have a problem in emptying your bladder when peeing. You might be feeling to pee well, but when you go, you see you pee a little and there's still more remaining. So you are standing there or you are sitting there. If you're a woman, forcing the remaining to come out, it's not going to come out. But you can feel that there are more to come out. But you only pee a little and stay because the nerves around your bladder is weak, so you cannot push it out. Okay. So let's go to number 13 is vaginal dryness. Number 13 is vaginal dryness. For women, you guys understand what I'm talking about. Number 13, vaginal dryness. Number 14 for men, erectile dysfunction. When you're having an erectile problem, all these have to do with nerves. Number 15, inability to sense low blood glucose. Number 15 is inability to sense when your blood sugar is low. And let's go to number 16 is vision trouble such as double vision. 17, increased heart rate. So friends, these are the symptoms of diabetic neuropathy. Do I have any question? Those are the symptoms of diabetic neuropathy. So now we are going to be moving to different types of diabetic neuropathy. So I'll be talking about what are the different types of diabetic neuropathy. But before I do then, let me remind you guys that for those that this is their first time coming across my page, if you have not subscribed to my page, kindly do so. All right. If this is your first time to come across my page, subscribe to my page so that anytime I'm going live, I have a new content drop off, you'll be notified to join me. If you like my program, the broadcast, if you like this page, give me a thumbs up. If you like my page, give me a thumbs up. You see, the importance of giving me a thumbs up is the more you give me a thumbs up, the more the page is made available to others that have not come across the page. So if you like my program, give me a thumbs up and also write your comments. I like to read from you guys your questions, what do you guys feel about the topic, and also share this page to your friends so that they'll be able to know there are places they can go and learn one or two things about their diabetic situations. Okay, so if this is your first time, subscribe to my page, give me a thumbs up, share, and comments. Right. So let's continue. Now, we're going to be discussing now what are the difference. So I'm going to be discussing what are the different type of diabetic neuropathy. We have 4 different type of diabetic neuropathy, but I'm going to give you guys 3 because of time constraint. I'm going to leave the last one. There are 4 different type of diabetic neuropathy, but I will only give you guys 3. So that all right. So what are the different type of diabetic neuropathy? Number 1 type is we have the peripheral neuropathy. You guys know about peripheral neuropathy. This is the most common form of neuropathy. Okay, peripheral usually affects the feet and legs, but it can also affect the arms and hands. That is peripheral neuropathy. Okay, the most common form of neuropathy is peripheral neuropathy. Peripheral neuropathy usually affects the feet and legs, but it can also affect the hands and arms. So that is number 1 type of diabetic neuropathy. The number 1 is peripheral neuropathy. And what is peripheral neuropathy? It's a kind of neuropathy that affects the feet and legs and also affect the arms and hands. Okay, it's the most common form of neuropathy that affects the feet and legs, but it also affects the arms and hands. So let's talk about the symptoms of peripheral neuropathy. Symptoms are varied and can be mild to severe. Okay, the symptoms of peripheral neuropathy can vary They can be mild to severe, and they include number one. Okay, these are the symptoms of peripheral neuropathy. Numbness. Numbness is number one. Two is tingling or burning sensation. Okay. Three is extreme sensitivity to touch. Four, insensitive to hot and cold temperature. When your feet or your legs cannot feel when the weather is hot or cold. All right. Or you are having extreme sensitivity to touch. When you are with your husband or your boyfriend and something you used to enjoy before, but when he's trying to touch you, you feel so sensitive to him touching you. Okay. You feel aggrieved. You don't want to be touched. Okay. So those are the symptoms of peripheral neuropathy. Remember, I said peripheral neuropathy, okay, is the most common type of neuropathy that affect the feet and legs, but also affect the arms, okay, the arms and hands also. And I'll give you guys the symptoms of peripheral neuropathy, which is numbness, tingling or burning sensation, extreme sensitivity to touch, and insensitive to hot and cold temperature. All right. Uh, Number 5 is sharp pain or cramping. Sharp pain or cramping. Let me see. Number 5 is sharp pain or cramping. Number 6 is muscle weakness. And number 7 is loss of balance or coordination. So those are the symptoms of peripheral neuropathy. Okay. So let's go to the second type of neuropathy. Now, you see, some people expressing symptoms often these symptoms I mentioned on the peripheral neuropathy. Sometimes you experience it at night. That does not mean you don't experience it during the day or during the day. Most of the symptoms occur during the night. Now, if you have peripheral neuropathy, you may not feel an injury or sore in your feet. People with diabetics often have poor circulation, which makes it more difficult for wounds to heal. This combination increases the risk of infection. In extreme cases, infection can lead to amputation. Okay, so some of these symptoms you might not feel it during the day. Not that does not mean you cannot feel it during the day, but most of the symptoms occur during the night. Now, if you have, let me put it here so that those are my fans that are deaf be able to understand what I'm trying to say. So if you have peripheral neuropathy, you may not feel an injury or sore on your foot. People with diabetics often have poor circulation, which make it more difficult for wounds to heal. So so this combination increases the risk of infection. In extreme cases, infection can lead to amputation. All right. So that is for peripheral neuropathy. Can we go to the second type of neuropathy? The second type of neuropathy is autonomic neuropathy. Okay. From the name, without you guys, from the name, you can tell what I'm talking about. This is the second most common type of neuropathy, autonomic neuropathy. Okay, this is the second most common type of neuropathy in people with diabetes. Okay, the autonomic nervous system runs other systems in your body over which you have no conscious control. Okay, this is something that has to do with immune system that runs other systems in your body over which you yourself have no conscious control. That is what is called autonomic neuropathy. It is the second most common type of neuropathy in people with diabetes. Okay, the autonomic nervous system runs other systems in your body over which you have no conscious control. Okay, so that is the definition of. Now, under this autonomic neuropathy, we're going to be discussing about what falls under it. Remember, it has to do with your nervous systems, which controls other systems of the body, which you have no conscious control. And under it, there are other things that fall under this category, like your digestive system, your sweat gland, your sex organs and bladder, and your cardiovascular systems. Those are your nervous systems. You have no nervous control over them. So that is why it's a nervous. That's why it's autonomic neuropathy. Okay, so there are other things that fall under it. And remember, we say neuropathy have to do with nerves. Your digestive system has a lot of nerve connections. Your sweat gland has enough nerve connections. Your sex organ and bladder has a lot of thousands of nerve connections. Your cardiovascular system has a lot of nerve connections. So when those nerves are completely weak, mild, or not mild, either weak or completely damaged, then you are having autonomic neuropathy. That can have an adverse effect in the functionality of those organs in your systems. So that is why it's a nervous neuropathy that controls other systems in your body of which you yourself have no conscious control of. That is what is called uh, autonomic neuropathy, which is the most common type of neuropathy in people with diabetics. Because if you have diabetes, believe me, you'll be having problem of digestive system. You're going to experience constipation. Okay, your sex organs and your bladder and your cardiovascular, you're going to have problem in those areas if you are not controlling your sugar level as advised. All right. So many organs and muscles are controlled by this system. Okay, many organs are controlled by these systems, which include digestive systems. Number one, sweat gland. Number three is sex organ and bladder. Number four is cardiovascular system. All right, so I'm going to discuss each of these organs and then let you understand how you have a nerve damage that affects how your blood sugar can affect your nerves functioning properly. Okay, now let's go to the when you're having a digestion problem. Okay, nerve damage to the digestive system may cause constipation. When you have your nerves damaged because of too much elevation in your sugar level, it's going to cause you to have constipation. And you guys know what is called constipations. Diarrhea, okay, swallowing trouble. You're going to find it very difficult to swallow. Okay, gastroparesis, which causes the stomach to empty too slowly into small intestines. Okay, so this is one area you're going to have a problem. One, you're going to have a digestive problem if your nerve is completely damaged or affected due to the high elevation of sugar level in your blood system. So that digestive problem falls under, autonomic neuropathy, which is the most common type of neuropathy in people with diabetes because what is going to affect your digestive system. And once your nerves are damaged, you're going to have a constipation, diarrhea, find it very difficult in swallowing. Let me, sorry for those that, let me paste this thing here so that Will I prepare my topic today? So under the autonomic neuropathy, you're going to have digestive problem. And when you have a nerve damage to the system of your digestion, you're going to have what? Constipation. Constipation. Just excuse me. Um, I'm trying to I'm trying to put it for those that cannot hear, they'll be able to see what I'm talking about. So bear me to let my other fans that are deaf, so they're able to hear what I'm talking about. Right. So we are still under autonomic neuropathy. And I said under autonomic neuropathy, it's all about dealing with your nerve damages. Because when your nervous system nerves are damaged, okay, then it affects the functionality of other organs in your system. And there are other organs that you have no conscious control that falls under this autonomic neuropathy, which is your digestive system, your sweat gland, your sex organs and bladder, and then we have your cardiovascular system. And I'm treating the first of which is the digestive problem. Now there are thousands of nerves that are connected to your digestion problem, and when the nerves that control the digestion is damaged due to the high elevation of sugar level, it affects the functionality of that particular organs. One, you're going to have what? Um, you're going to have constipation. Number two, diarrhea. Number three, swallowing trouble. And number four, you have to gastroparesis, which causes the stomach to empty too slowly into the small intestine, from the large intestine to the small intestine. All this is surrounded by nerves. So that's one issue you're going to have when you are not controlling your sugar level. You're going to have digestive problem. 1 in 10 of patients that are diabetics experience this trouble. I experienced it when I was newly diagnosed as a diabetic. I experienced digestive problem because my sugar level was still high that time. But as time goes on, I control my sugar level, everything fall in place. I was able to deal with this issue. I have a lot of constipation issue, a lot of problems. I find it very difficult to pass in our stools because the nerves controlling the digestive problems were affected. So I have to do what is necessary to do to regain those consciousness. So 1 in 10 people that are diabetes is going to experience this digestion problem because the nerves around it is going to damage if you're not controlling your sugar level. Okay. Now, what is someone is asking me what is let me type the question here. What is somebody is asking me what is gastroparesis? Simple term. Somebody is asking me what is gastroparesis? Is when there is a delay in digestion, when you're having incomplete digestion. When there's a delay in digestion, you're having gastroparesis because there's a delay in digestion. Or when you have a digestive problem, it can vary. You might not have a delay in your food to be digested. It might be digested but not completely digested. Sometimes when you finish eating, you pass your stools. You see there some of those food that you eat still comes out without being digested. You can still see them in the toilet bowl. They are not completely digested. Some of your food are digested, but if you look at your stools, there are those food like a yam or whatever you eat, cassava, you still see the lumpness that food was not broken down because the nerve controlling that particular organ is weak. So that is why it is not completely digesting all the food you eat. It digests some and leaves some, so you pass it out. So when you have a delay in digestion, then you are having gastroparesis, which can worsen over time if you do not control your sugar level to avoid the complete damage of your nervous system. I mean, your nerves. Okay, so that is it. When there's a delay in your digestion, okay, that is when you're having gastroparesis because there's a delay. And again, if your nerves are not completely damaged, maybe mild, you might have some of your food that you eat digested and some are not digested, so you excrete them out. So that's why when you see your stools, okay, you see that there are some food that you eat that are not completely digested and you pass it out. So that means you are having some digestive problems. And that is why I have said to you guys several times that anytime you finish passing your stool, do not just flush it away without looking at it. First of all, look at it to see how your stools look like. So when you notice that not all the food that you eat are digested, you know that you're having digestive problem and try to find a resolution to if constantly seeing it anytime you eat food 1, 2, 3 times, then you go and see your doctor. That is a sign that you're having a digestive problem. Now, most importantly, I've said to you guys, there is no way you should see any blood in your stool. That is why I say anytime you finish passing stool, look at it before you flush it out. There is no way you should see any slighted blood in your stool. Anytime you see blood in your stools, it's a cause for concern that you have to see a doctor. It's a cause for concern that you have to see a doctor that I saw is blood in my stool for them to check it out. The earlier, the better. That is why I've advised you guys, anytime you finish passing your stool, look at it very well, then you flush. The same time when you finish doing your urination, do not just sit there and then stretch your hand and flush your urine without even looking at it. Look at your urine very well. Look at the color. Okay, you know how the color of your urine is over a period of time. When you notice serious changes of your urine, one, or you notice a smell, an odor that you are not conversant with. Each and every individual has a urine smell. Every inhuman being, their urine smells differently. Nobody smells alike. Every human being on earth, when they pass a urine, they have a match urine pasted to you. It's different from somebody else's urine. So when you see the odor of your urine changes to what you are used to and smells so awfully, then there's a cause for concern to either check for you if you have any UTI. You have any UTI, or to investigate more why my urine smell horribly. Two, the color of your urine also would tell you if you're having a problem in your system. Three, there is no circumstances you should see blood in your urine with your naked eye. Anytime you see blood in your urine with your urine, it's a cause for concern that you have to go and see your doctor immediately. There are some blood that you cannot see with your eye, except when you cannot. There's some blood in your urine you cannot see with your physical eye, except under a microscope they can see a trace of blood. And when there's a trace of blood that you cannot see with your naked eye, except under microscope, then there's a cause for concern for them to investigate further to find whether there's a urine in your urine, whether there's a blood in your urine. Then they will send it to a urologist to do some tests, which is so invasive. Or protein in your urine. There shouldn't be any protein in your urine. When there's a protein in your urine, then you have to check it out. So these are the things you have to consider. Anytime you pass a urine, do not just flush out, look at your urine, check out the smell of your urine, the color of your urine, and then know if it is normal or something you have to see a doctor. So what is gastroparesis? Is when there's a delay in your digestion. When there's a delay in your digestion, then you're having a problem in that area that are a result of your nerve damages, okay? And which can worsen over time. So leading to frequent nausea. So when there's a delay in your digestion and which can worsen over time, okay, it can lead to frequent nausea and vomiting. Okay, so let me paste this, let me write this down for my fans that are deaf, so they know what I'm talking about. So let me put it on my screen so that my fans that are deaf will know what I'm talking about. So gastritis causes a delay in digestion, which can worsen over time, leading to frequent nausea and vomiting. You will typically feel full too quickly and be unable to finish a meal. Okay. Okay. So I hope I've answered your question. The person that asked me what is gastrocrisis, I hope I've answered that question. So I'm going to revert back to what I'm talking before. Okay. So we are still on digestive problem. Now let's go to the second problem under autonomic neuropathy. The second problem you're going to feel under autonomic neuropathy is a sexual and bladder problem. Okay, so this one is very self-explanatory. Okay, autonomic neuropathy may also cause you to have a sexual problem such as erectile dysfunction, vaginal dryness, or difficulty achieving orgasm. Okay, neuropathy in the bladder can cause incontinence or make it difficult to fully empty your bladder. Okay, so that is let me see if I put this for my fans that are not can hear me properly. So autonomic neuropathy may also cause sexual problems such as erectile dysfunction, vaginal dryness, or difficulty achieving orgasm. Okay, all these things have to do with your nerve damages. So if you are not controlling your sugar and you are diabetes, these are part of the complication you are going to experience. You know, if you're a woman, you go loss of libido. If you're a man, you're going to have ELD, okay, because your nerves in that area are either damaged or complete damage. Okay. Now, if you are on your bladder, the neuropathy in your bladder can cause incontinence or make it difficult to fully empty your bladder. So all these are as a result of not controlling your sugar level. That is why I say I'm going to tell you guys everything you have to know about diabetic neuropathy, because there are neuropathy is one word, but underneath it, when you start breaking them down, you see that there are nerves, because all our body are connected with nerves. And when those nerves are affected one way or the other, the functionality of your organs in your system is also affected. So if you're a woman or a man and you're diabetic and you're experiencing erectile dysfunction, or you are a woman and you have vaginal dryness or loss of libido, and you're diabetes, this is as a result of you are not taking care of your diabetic situation. You are allowing your sugar level to fluctuate up and down. You are not constantly monitoring your sugar level. So as I said, it's a gradual process, slow progression from my stage one, stage two, day by day, second by second, week by week, you are damaging your organ that are connected to your sexual organs. And by the time you know it, you are having problem having erection, or if you're a woman, you have loss of libido, you don't enjoy sex anymore, because you over a period of time, you've allowed elevated too much sugar in your bloodstream to affect your system and damage your nerves. So that is why you have to, once you are diagnosed as a diabetic, you have to take it seriously to make sure you have control of it so that it doesn't damage your organs, so that you can live a normal life. If you're diabetic, you can live a normal life. One thing only is to respect the norms governing diabetes. Obey the rules and regulations governing diabetes. Once you stay away from those things they ask you to stop doing and concentrate on those things they ask you to do, you are going to live a normal life. It doesn't affect you enjoying sex. It doesn't affect you living a normal life, having children. The question, you have to be disciplined in following your doctor's guidance and taking your medication, exercising, eating healthy food. All right. So that is that aspect of it. Now, the last one is the cardiovascular problem. You're going to have a cardiovascular problem, damage to the nerve that control your heart rate and your blood pressure. Okay. So when that is, our hearts are all in, there are thousands of nerves that are connected to our heart. So when you're having a cardiovascular problem, the nerves that controls your heart rate and your blood pressure can make them respond more slowly. Uh, let's go to the last one on that under autonomic neuropathy is cardiovascular problem. Okay, so if you are having, not, are you are you guys listening to me? You guys have any question? Because I have not gotten any question. There's only one question that I've gotten. So do you guys have any question? Post your question for me. Okay. Now we have cardiovascular problem is the damage to the nerves that control your heart rate and blood pressure that can make them respond more slowly. Okay. So there are thousands of nerves that are connected to our heart rate. I'm going to paste it for my. So, cardiovascular problem. Okay, I'm talking about the cardiovascular problem. And as I said, cardiovascular problem, we have many nerves that are connected to our heart rate. So, damage to the nerves that control your heart rate and blood pressure can make them respond more slowly. You may experience a drop in blood pressure and feel lightheaded or dizzy when you stand up. Or after sitting or lying down, or when you exert yourself. Okay, autoimmune neuropathy can also cause an abnormality in your heart rate. So, so that is it under the uh, autonomic neuropathy. Okay, I'm having too many calls. Those that are calling me on my WhatsApp, I'm going to respond once I'm live now. I'm going to call you guys back. I note all your calls. I'm going to call you guys. I'm going to call you guys back one after the other, and then we can discuss further. So, so that is under autonomic neuropathy. You're going to have digestive, you have the sweat gland, okay, you have your cardiovascular, all right, and you have your sexual or bladder problem. So that falls under autonomic neuropathy. That is why it says it has to do with your nervous system that controls other organs of the body that you have no conscious control of it. Okay, so that is it on that aspect of it. Now, let's go to the third one. As I'm going to give you guys three types of diabetic neuropathy. The third one is proximal neuropathy. We have proximal neuropathy is the third one. Okay, proximal neuropathy is a rare form of neuropathy known as diabetic, amyotrophy. Okay, it's a rare form of neuropathy. Another word for it is diabetic amyotrophy. This form of neuropathy is more in men that are over 50 years old with type 2 diabetes and is diagnosed more often in men. This is a form of proximal neuropathy, is mostly type of neuropathy that is mainly found in men over 50. And another word for it is diabetic amyotrophy, which is a form of neuropathy that are in adult over 50 and mostly found in men. Okay. So a rare form of neuropathy is proximal neuropathy, also known as diabetic amyotrophy. This form of neuropathy is more in adults over 50 years old with type 2 diabetes and is diagnosed more often in men. Okay, is diagnosed more often in men. All right, is diagnosed more often in men. Somebody send me a question. I'm trying to grab that question and see what it says. All right. So now it often affects the hips. This type of neuropathy often affects the hips, the buttocks, or thigh. You may experience sudden and sometimes severe pain. Muscle weakness in your legs may make it difficult to stand up without assistance. So this type of neuropathy, okay, proximal neuropathy is a rare form of neuropathy found in men over 50 years old that have type 2 diabetes. All right. It affects the hips, the buttocks, or thigh. You may experience sudden and sometimes severe pain. Muscle weakness in your legs may make it difficult to stand up or without assistance. Now, diabetic amyotrophy usually affects only one side of the body. Okay, after the onset of the symptoms, they usually get worse and then eventually begin to improve slowly. Most people recover within a few years. Okay, so that is the third type of diabetic neuropathy, the proximal neuropathy. One, it's mainly a form of neuropathy that is found in men over 50 years of old with type 2 diabetes. Okay, it is diagnosed more often in men, adults over 50 years of old with type 2 diabetes. They say more often does not mean women doesn't have it. You have to understand the language. It does not say only in men. It says it's diagnosed more often in adults over 50 years of age with type 2 diabetes, more often in men. Does not mean that women are excluded. Now, it affects the hips, the buttocks. Okay? It affects the hips, the buttocks, or the thigh. You may experience sudden and sometimes severe pain. Muscle weakness in your legs may make it difficult to stand up without assistance. But one good side of it is that it usually affects one side of the body, and, and after the onset of the symptoms, they usually get worsened and then eventually begin to improve slowly. Most people recover within few years. Okay, so that is diabetic amyotrophy. That's another word for it, proximal neuropathy. So now let's go to what causes diabetic neuropathy. This is very simple. I don't even need to dwell on it. Um, I say we have 4 types of diabetic neuropathy. I only give you 3. The last one I'm going to discuss it some other time, which is the focal neuropathy. The focal neuropathy has to do with your eyesight. Remember, our retinas and the back of our eye is connected with nerves. Okay, so that is called the focal neuropathy. It has to do with your eyesight. Okay, uh, your eyesight. Okay, so that is the focal. That's the fourth one. Okay, the nerves on your eyesight. Also, apart from the nerves in your eyesight, it also affect other areas of your body like your hand, your head, your torso, or your leg. Okay, and it's very, very painful. So apart from the focal aspect of it on the nerves that are connecting your retina at the back of your eyesight, it also affects your hand, your head, your torso, your leg, and it is very painful. So those are the 4th one that I have not listed here. But let's me go to the what causes diabetic neuropathy. I'm not going to dwell too much on this because we all know what causes diabetic neuropathy. We all know what causes diabetic neuropathy. It has to do with your sugar level. If you're diabetic, you have to control your sugar level. When you're having hyperglycemia all the time, then you are inviting diabetic neuropathy. Okay. When your blood sugar level is too high, sustained over a long period of time, then causes you to have diabetic neuropathy. That's why I'm not going to, dwell on this for too much time because we all know it has to do with your hypoglycemia, high sugar level in your bloodstream. Okay, over a period of time, then from slowly to the higher progression of it, from mild to worse. So from stage 1 to stage 4, those are the slow progression of diabetic neuropathy. So you have to control your sugar level to avoid diabetic neuropathy. So we all know the causes of diabetic neuropathy. It has to do with the level of the hypoglycemia, and then uh, the damage to the blood vessels causes high. When the damage to your blood vessels is caused by high cholesterol levels, uh, okay. For the benefit of my fans that are deaf, I'm going to post it. Otherwise, I don't want to paste it. So diabetic neuropathy is caused by high blood sugar levels sustained over a long period of time. Other factors can lead to nerve damage, such as um, number 1, damage to the blood vessels caused by high cholesterol levels. Remember, damage to the blood vessels caused by high cholesterol levels. Number 2 is mechanical injuries, such as injuries caused by carpal tunnel syndrome. Okay. Number 3 is lifestyle factors such as smoking or alcohol use. You're welcome, Alex. Allah, you're welcome. Watching from Ghana. All right. So, so I was talking what are the causes of diabetic neuropathy, and then I've explained it. It's caused by high blood sugar levels sustained over a long period of time. Other factors can lead to nerve damage, such as number 1, damage to the blood vessels caused by high cholesterol levels, mechanical injuries, such as injuries caused by carpal tunnel syndrome, and number 3 is lifestyle factors such as smoking or alcohol use. Okay, and then we have the low level of vitamin B12. Low level of vitamin. I think I've discussed in one of my videos the importance of taking your vitamin B12 and what is the when you have a low level of vitamin B12, what are the consequences? Or when you have a low level of vitamin D, what are the consequences? Check your potassium level is very important. Your sodium level is very important also. So low level of vitamin B12 can also lead to neuropathy. Metformin, a common medication used to manage diabetes, can decrease the level of vitamin B12. So that is why you have to be very careful um, in managing your diabetic neuropathy. So these are some of the causes of diabetic neuropathy. Okay, low level of vitamin B12 can also lead to neuropathy, and metformin, a common medication used to manage diabetes, can also decrease the level of vitamin B12. You have to understand the importance of vitamin B12 to know why metformin can decrease uh, the level of vitamin B12. Okay. Now, you can ask your doctor for simple blood tests to identify any vitamin deficiency in your system. That is why you have to do your CBC test, your complete blood count test. Anytime you are going for your quarterly blood test as a diabetic, make sure you do your CBC test. I've discussed the importance of CBC test, which is the complete blood count test. So ask your doctor to do a blood test to identify any vitamin deficiency in your system. Okay, vitamins in your body as a diabetic is very important. To make sure you ask your doctor to do a simple blood test to identify any vitamin deficiencies. Okay, now let's talk about how diabetic neuropathy is diagnosed. Okay. Any question? I'm coming towards an end to my program for today's. So, how is diabetics neuropathy is diagnosed? That is the question. Now, if you have peripheral neuropathy, you may not feel an injury or sore on your foot. Okay? People with diabetes often have poor circulation, which make it more difficult for wounds to heal. Okay? Now, this combination increases the risk of infection. In extreme cases, infection can lead to amputation. So, how is your diabetic neuropathy diagnosed? A doctor will determine whether or not you have neuropathy, starting by asking you questions. The symptoms. First of all, your doctor will be asking you about your symptoms, questions about your symptoms, and uh, too many calls. Please, I'm going to call you guys back. I'm online. I'm going to call you guys back. Since I circulated my WhatsApp number, I've been getting too much calls. So I'm going to call you guys. I know those that are calling, and I'm going to call you back once I'm offline. I'm on online right now doing live video. So I'm going to call you guys back. Okay. You that is calling me, I say I'm going to call you guys back. Okay. I'm on live now. So let me finish the program and I'm going to call you guys back. So doctor is going to start by asking you your symptoms and medical history. Okay. You also have to have a physical examination. First of all, that's how doctors try to diagnose your neuropathy. It's the symptoms you come with. What are the symptoms you've been experiencing? What is your medical history? Okay. And then from that, they go to physical examinations. They will check your level of sensitivity to your temperature and touch, heart rate, blood pressure, and muscle tones. The physical examination is very simple. Sometimes you stretch your hand, ask to stretch your hand. This way, see the way I place my hand, ask to stretch your hand. And then the doctor is going to touch each, try to test each of your finger and then let you know, and then you are going to respond. When he touches your finger, he's going to tell you, do you feel my finger? He said, yes. He's going to touch each and every one of them in different part of your finger to know where you are feeling, wherever he touches, he says, yes, I can feel it. The same thing, all your fingers, your arms, and then the same thing on your feet. He's going to ask you to stretch your feet. He's going to test your toes. Okay, he's going to touch your toes to see if you are feeling the touch and then the level of the feeling. Because if you're having, if you're too, if you're having, if you're this, the level of sensitivity is too high, you're going to respond when he touches it and ask you. In fact, you are going to tell the doctor what you are feeling. So they're going to test this level of sensitivity of touch, or if you are not feeling any touch at all. So those are the physical examinations, and then your nails. Okay, Your nail is going to ask you to bend your nail, okay, and it's going to use something and then knock on your nail to see if you can feel any pain or feel the touch. So there are physical examination they are going to feel, and then they're going to ask you to stand up over a wall, stand on a wall, your back facing the wall straight, and then stretch your hand to see how you stand. Okay, how you can stand over a period of time. So there are different ways. It's going to do some physical examination to test if you diabetic neuropathy. And the most important aspect of what is going to check your feet to see if there's any blisters, if there's any wound, if there's any cut around your feet that might arise to ulcer. Okay, one thing you have to avoid is ulcer in your feet. For those that doesn't know how diabetic ulcer, foot ulcer is, you go and Google it in their phone. If you're diabetic, what is diabetic foot ulcer? Just Google foot ulcer in your phone, and you're going to see the way it look like, so that you have to now be conversant with your feet to know when you have such blisters or wound to see a doctor immediately. And that is why I've said in the beginning of my program that as a diabetic, you have to, as a diabetic, if you're a diabetic or you are looking after someone that is diabetic, every day, every afternoon, every evening, you must check the feet of that person all around. As a diabetic, you must check your feet, pay attention to your feet to see there is no wound, there is no blister, there is no crack, there is no foot ulcer, there's no any sign of foot ulcer in your feet. That is why doctors check your feet all around to make sure there are no wounds. And if you notice any abnormality in your feet, like look like red blisters, either underneath your feet or on top of your feet, anywhere, if there's any ingrown in your nail toes, if there's you see the toe, your nails in your toe, you check, see the coloration, are they yellow? Is there any ingrown? These are certain things you have to pay attention, check it very well properly. And if you notice anything that is abnormal in your feet, ingrown, coloration of your toes, okay, redness either underneath your feet or on top, see a doctor immediately. It is important you see a doctor before it turns to full-grown ulcer, because when it becomes a full-grown ulcer, there's the possibility that you're going to get amputated. That toe is going to get cut off, or that leg is going to get cut off. So you got to pay attention to your feet all the time. If you're a caregiver, make sure you check your feet all the time to the person you're taking care of. And then avoid falls. As a diabetic, avoid falls, avoid wound. Anything that's going to give you cut or wound, avoid it. It is very, very important. That is the beginning. Anytime you have cut in your feet or any part of your body, it is very difficult to avoid infection, because if you get infected, there's a possibility you're going to get amputated or lose your limb or your hands. And that is why you have to check, make sure that if you're diabetic, avoid anything that is going to make you have an open wound, because it takes a longer period of time to get healed. And if there's a tendency for you to get infection on it. So those are the ways doctors check, diagnose the neuropathy, okay, to make sure you have any sensitivity to your faith. Okay. Uh, okay. They might use a nylon fiber to check your limbs for any loss of sensation. A tuning fork may be used to test your vibration threshold. A tuning fork, they use a tuning fork to check the vibration threshold when they ask you to bend your nail or stretch your feet, and then they will use that tuning fork to hit on each of it. They are testing the threshold of your vibration. So a doctor may also test your ankle reflexes. Those are things they check on the physical examinations. But you, as an individual that is diabetic, you must pay attention to your feet. You must check your feet all the time. Check your feet in and out all the time to make sure there are no blisters, there are no changes in the color, red spot in your feet, underneath your feet, or check your toenails to make sure there are no coloration, ingrown of nails. These are very important to take care of your feet. It is very, very important that you pay attention to your feet. Very, very important. So now the last aspect of it is, how is diabetes treated? Okay. How is diabetic neuropathy is treated? How is diabetic neuropathy is treated? Now, before I because this is going to be the last section. Um, now, on my program, now I have a feature on my program. I said it in my last video. Uh, anytime I'm on live video, if you want to come live to join me on the program, you have to send me a message that I want to come live, and then we can discuss face to face. Then I will send you a link that you can click in to join me live. If you want to join live, uh, then you once you send me a message that look, I want to come live, I want to join you on the program. I will send you a link that you're going to click to come live with me, and then we could have a conversation. Or if you want to ask your question live, you could send me a message that I want to come live with you, and I will send you a link to join me live. All right. Now let's go to how diabetes is treated. How diabetic neuropathy is treated. Okay. Uh, if you're a smoker, you have to quit smoking. Okay, you have to quit smoking. Keeping your blood sugar level within a healthy range is the best way to decrease the likelihood of developing diabetic neuropathy. That is the simple aspect of it. Everything has to do with your sugar level. Keeping your sugar levels within the healthy range all the time, not sometime, is the best way to decrease the likelihood of diabetic neuropathy or slow its progression. Okay, it can also relieve some symptoms. And that is why I've said to you guys in the past, anytime you have any burning sensation in your feet, it tells you that your sugar level is too high. As soon as your sugar level drops back to normal, that burning sensation will disappear. So the, the best likelihood of decreasing the likelihood of you developing diabetic neuropathy is keeping your blood sugar level at within the healthy range that is required all the time, not sometimes. Controlling your sugar level is very paramount. You have to control your sugar level. Okay. And then, secondly, if you're a smoker, you have to quit smoking. You have to quit smoking. It is very, very important you quit smoking. Okay. Then, okay. And again, the aspect of it is exercise. You have to be physically active. Make sure you exercise regularly, 2 or 3 times in a week. 30 minutes per each session is takes a lot. So these are some ways you can treat diabetic neuropathy, and also pain management. Doctors can recommend you some medication to manage your pain caused by diabetic neuropathy. Okay, there are some medication that can be used to treat diabetic neuropathy. Okay, there are some medication that can be used to treat uh, neuropathy. Okay, so that's another topic for another day. I'm not going to go into it now. That's another topic for another day. And then managing your complications. You got to learn how to manage your complications. And I've said it several times. Managing your complications is very important through medication, therapies, or lifestyle changes. Okay. If you want to manage your complication, it's one medication, therapies, or your lifestyle changes may help you to manage all those complications. I've said to you guys, it's all about controlling your sugar level. Controlling your sugar level, it is very, very important. So somebody's asking me, can I prevent diabetic neuropathy? Yes, you can prevent it. It's all about avoid. Diabetic neuropathy can often be avoided if you manage your blood glucose very, very well. Okay, can you avoid it? Yes, it has to do with managing your sugar level very, very well to make sure it is within the healthy range. Okay, to make sure it is within the healthy range. Okay, so someone is asking me, can I prevent diabetic neuropathy? And the answer is yes. It's all about it's all about uh, it's all about managing your blood sugar glucose very, very well. So fans, I'm going to leave you guys here now. I think I've been here for about 1 hour 25 minutes. Since today I don't have much question, which is good. If you have any question in later on, you can send me your questions later and I will respond on the site. I would like to read your comments regarding this program, how helpful it is. Okay, give me a thumbs up if you like this program. Subscribe to my page and then share. So while I wait for your comments, your questions, your thumbs ups, I'm going to try to see you guys next time that I'm going to be live. Probably tomorrow, Sunday, I might be live, but I'm not sure. So I wouldn't guarantee. But if I'm live, I'm going to go live. I'm going to give you guys heads up. So once again, I thank you guys very much for staying with me today to deal with this program. And then at this point, I'm going to let you guys enjoy your weekend, evening, wherever you are, afternoon, wherever you are, morning, wherever you are. And then if there's any comment, any questions, send it to my page and I'm going to respond to your questions. And for those that are coming across my page for the first time, if this is your first time, give me a thumbs up, all right? And then subscribe to my page so that anytime that I come live, you'll be notified, all right? Anytime I post new content, you'll be notified. Once more again, to support this page, try to give, if you want to support this page, if you like what we're doing, is to buy a star and send a star to the page, to my page. If you want to, the only way you can support this page is to send the star. And how do you send the star? Underneath my video, underneath on each video, you see where it says give. Okay, underneath my each video, you see where it says give, or if you see a star icon, if you see a star icon, click on it, or if you see where it says give, click on it, or if you see where it says thanks, click on it underneath each video, and then it's going to direct you to the Facebook page where to buy star and then send to that page. So if you want to support this page. So once again, I thank you guys very, very much for today. And I'm going to see you guys some other time in the future. Once again, enjoy your weekend. Goodbye.